Hi. Okay, so we are here to talk about MS. And many of you may not know, because your doctors may not know, there is a big, strong link between Lyme disease and MS. And Dr. Phillips has had so much experience in treating patients with MS and getting them better on antibiotics when they were given the immunosuppressant treatment by their other doctors. And I think it's fascinating.
So
I hear from so many of your patients about the MS.
Mm-hmm.
Like, I got out of a wheelchair.
Yeah.
I no longer have to be homebound. I mean, I got my vision
are
back.
right. Yeah,
I got my vision back.
Mm-hmm.
I just heard that the other day.
So, yeah, these are very compelling kind of stories, and it's true. There's a big link in the scientific literature between MS and spirochetal infection. It was discovered kind of back in the 50s. They did autopsies of patients with MS, and they found spirochetes in the brains, and they didn't know what it was. It wasn't syphilis, and they called it spirocheta myeliflora, which means in Latin, myelin destroyer. And myelin is the insulation around the nerves that gets destroyed with MS, and turns out that the tail of the spirochetes is flagellin, and flagellin immunologically is almost identical to the immune system as myelin. So the immune system cross-reacts and sees flagellin, thinks it's myelin, and then now will start attacking myelin. And there is a immunologic kind of microbial basis for the development of multiple sclerosis. So, yeah.
So you have said, and I've also heard other physicians say, that there is no differentiating feature. Radiologic, blood, brain scan, neurologic feature that can be differentiated between Lyme and MS. Can you just talk about that a little bit? Is that definitely true? And
So MS, like so many conditions of medicine, is a non-etiologic diagnosis. You know,
can you explain what that means?
Of course, yes, of course. So when I went through med school,
He thinks everybody's a doctor.
No, it's not that. So when I went through med school, I was seriously shocked about how many diseases are mysteries, and particularly the chronic illnesses. And it was very disappointing.
And the autoimmune illnesses, right?
Yeah, a big black hole in medicine. And with multiple sclerosis, kind of that's one of them. So they don't know what causes it. It's just this sets of signs and symptoms, and all of these signs and symptoms can be seen with Lyme. So they say that Lyme can mimic MS, but if it mimics it and it can be clinically indistinguishable to MS, which has been published, then in that person's MS, Lyme is causing their MS.
What do they do? All right, what do they do? I want to stop you because now you're going to have people's attention. Where do I go? I was diagnosed with MS. I've had it for 5 years. I've had it for a year. So if people have been diagnosed with MS in a previous year, can they still come to somebody who may be able to figure out that there's an underlying infection and treat it? Can people get better after they've been on immunosuppressants? Yes,
I've definitely seen that many times. I mean, I think we have to differentiate the progressive forms of MS from relapsing and remitting. The relapsing and remitting MS cases, which are the majority, respond much better. First, we have to, I don't want to speak with certainty. Like I said, I always like to be neutral about things. I'm not saying Lyme causes every case of MS. I'm not saying spirochetal diseases cause every case of MS, but this is what the literature kind of shows us.
So what is your experience in treating MS patients? Like, what's the percent, if you can give a rough estimate, is it a high, medium, low? What's the percentage that come to you with an MS diagnosis and then get better under your care, whereas they were just sort of plateauing on their MS treatment?
So let me answer that question, but let me build the foundation first and just give some of the scientific background, if that's okay? Because I want to just not be overly optimistic.
It's okay. Go ahead.
Okay. So I like to be neutral, but being neutral is saying, holy crap, there's a big association. That's me being neutral. And so they've done studies where they've inoculated baby animals with tissues from patients with MS, and the baby animals got progressive neurologic disease. And there, is a...
That's very compelling. Why isn't this on the front page of the New York Times?
They did a study where they isolated round bodies of Lyme bacteria from the spinal fluid of every MS patient. It was published in a major infectious disease journal, and it didn't wind up on the front page of any newspaper. Why don't you know about it?
Why didn't I know about that? So the other question is, I have seen a correlation on the CDC tick map with a higher incidence of MS. So where there's a higher incidence of Lyme disease, there's a higher incidence of MS. Is that a coincidence?
I think the map you're referring to is statistics a student had put together by county throughout the United States from Census Bureau data of death statistics from Lyme versus death statistics from MS. And if you just search MS Lyme map, on Google,
Yeah.
it comes up under images.
It's been sent to me many times.
It's very compelling. I mean, they break it down by county throughout the United States, and it's interesting because it's a large number observation. I love the large number of observations.
Why are doctors so resistant to looking into the cause of their patient's MS? I don't understand. Why, so many times I get a call from a patient saying, my doctor won't even have this discussion with me. I have got no insight because I think it's insane not to try to treat the root cause of a disease.
I think because doctors aren't researchers. They're waiting for some researcher somewhere to say this is how it is,
but it's not
write
even
a guidebook, and then they just follow the guidebook.
But I'm not saying they need to do... I'd say if this patient comes, look, I saw an interview, or I read an interview, or I saw a study that said that Lyme could be linked to MS. Could I be checked thoroughly for Lyme?
Yeah.
And they say, no, this isn't Lyme. Anybody that tells you that is nuts.
Yeah.
What do we do? How do we combat that? And where do patients go? Like, I can just tell people where I would go would be an ILADS doctor, ILADS.org. The reason I would do that is because those are the specialists in this country that have been trained to look for tick-borne diseases as an underlying cause of illnesses. But what do we do? Infectious disease doctors won't do it. Rheumatologists won't do it. Pediatricians won't do it. Internists won't do it.
I hear you. I don't know what to do either. I would just say that if it were me, if somebody had diagnosed me with MS, I would definitely look into spirochetal infection. And Lyme tests, they can be negative and people can still have Lyme. The matter becomes somewhat academic when you take into account all these other strains of spirochetes that are Lyme-like spirochetes for which we don't even have good tests. And conceivably those spirochetal infections could also produce autoantibodies and immune response against flagellin. So if you look at the things that support a case of MS, like how do you get diagnosed with multiple sclerosis, whether it's spots in the brain or spinal cord or optic neuritis or oligoclonal bands, which are autoantibodies in the spinal fluid, or evoked potentials or quantitative EEGs or any of a number of other tests, every one of those tests is also published to be abnormal or can be abnormal with Lyme.
So I get a lot of this. No, I have real MS because I have spots on my brain. And I try to tell patients, that doesn't matter. That's not, you don't have real or fake MS. That's still an MS-like presentation. It doesn't mean it can't get better.
So so now to answer your question before, out of the relapsing remitting MS patients that have come to see me, I used to do talks on MS all the time when I was younger because I was kind of outraged by the lack of interest, like you're saying. And for me, outrage, it's like so mellow. For me, getting outraged is like, boy, this really stinks. But, you feel kind of...
I don't agree with that. I think I was going to get a little riled up.
I don't know. I mean, it's hard because, how do you make a stink and be neutral at the same time?
Also, you can't maintain that level of rage because you just fizzle
out.
out.
Yeah, you fizzle out. And
what are you going to...
doesn't accomplish anything. But
I do that for you. That's why they call us yin and yang.
Okay.
I'm a mad one.
Yeah.
Outwardly.
The mad lady. So not being optimistic, just based on my experience and just the experience that I've had over 21 years and seeing so many patients with these conditions, the large majority in whom we find evidence of Lyme, which is the large majority, respond to antibiotic therapy. Plain and simple. I would say again about, if we do treat with rounds of long-term antibiotics, about 50% of those patients respond radiographically as well, so their brain and spinal cord lesions resolve.
That's amazing. You're saying that like you're talking kind of fast, but I'm thinking, whoa, the whole time you're talking.
I was thinking, whoa, at the beginning too, but
This is the beginning for a lot of people. This is the first time they're seeing this information, and I hope they're bringing it to their doctors because
I'm so sorry to speak like this is old hat. I actually stopped giving talks about the relationship of spirochetal infection and MS because my practice was getting skewed toward MS.
I understand.
And I haven't talked about this topic in years.
Well, thank God you are, because there's so many. How many people in the country? Do you know the numbers on MS?
No, I don't. I thought it was 250,000 at some point. I thought that was it, but I'm not sure. I could be wrong.
So, can you just before we go, can we hear about just 1 minute, a 1 minute case study of a really incredible MS story, recovery story?
Oh, I have a few, but
just give us your best one.
Yeah. So someone that I've treated, nice guy, had near complete hemiparesis, which means one side of his body was paralyzed and he was completely non-functional, and he had an active lesion in his spinal cord, and when we did the MRI, he had like 10 lesions in his brain and a few more in his spinal cord. And he had Lyme before, a known kind of diagnosis, and it kind of, you know, not with long-term treatment, came on out of the blue. And he had other symptoms that he ignored, like heart palpitations and vertigo and some tremor and night sweats and all these things that he just didn't chalk up to anything. They weren't serious enough at all to interfere with his life. He wasn't like a sick guy, and then all of a sudden got paralyzed. And
what do you mean he got paralyzed? The whole
like
body?
within 3 days, his whole one side of his body could barely move.
Yikes.
Yeah. So he had a good outcome to treatment. Most of his brain and spinal cord lesions resolved with antibiotics.
How long did it take?
A long time. So in order to get him better, at the beginning, back in the old days, I used to use more IV antibiotics than I do now. Now I don't use IV antibiotics really at all because the studies haven't shown superiority of the IV
Talk
over
about
the
that
oral.
another time for sure.
Yeah, for another video. So, but I did in the old days, and I had him on some orals, and he was responding, but it wasn't, you know, fast enough for either of us, but he definitely was responding, and I actually put him on Rocephin, and he had a very good response, and I thought his lesions would all be gone. We repeated another MRI, and the one active lesion was almost gone, and the rest of them didn't budge. So I was like, oh, these must be old scars, and that's why they're not going. But he still had a little bit of some symptoms left over, and some neurologic stuff, and I ended up giving him rounds of combinations of oral antibiotics that get into the brain and get inside cells, and I think that, you know, working synergistically. And he had a very, very good response. And he, you know, at the time he went to a couple of neurologists, and they said, you have MS. They're diagnosing him with MS. They offered him the immunosuppressors, and he chose to go with antibiotics. And
do patients ever go back to their doctors and go, you messed up, I got better on antibiotics, you told me, you threw me, you know, to the wolves, to the immunosuppressive wolves, and here I am?
I always advise them to. I always say,
me too.
Please do this. It's not going to help you.
Do they ever do it?
Yeah, they do. They do. But it's not often enough. I mean, and I'm not saying to do it in
Doctors
an angry way.
need to
I'm
learn.
not saying to do it in an angry way. I say, this is my experience. This is my reality. And you have to justify what happened to me. You know, you have
right.
to...
The patients are rightfully angry because they're not being listened to. And it's not just that there's a lack of knowledge. There's a lack of curiosity.
Yeah.
And I think for me as a patient, that's the biggest problem, is that I experienced so many doctors who just weren't curious about what was going on. They weren't curious enough about it to even hear me out completely.
I think that humans are simple beasts. You know, we all want to be heard and understood and feel like we're being...
I don't think you are.
I'm a simple beast.
You're not a simple beast. You're a very complex animal.
So I to kind of wrap up the video, I think that when I see a patient with relapsed remitting MS, I don't feel hopeless at all. I'm not saying it's great. I think it's still kind of a sucky thing, but knock wood, because I've seen mainly good outcomes. I have some that have not done well. Don't get me wrong. I do not want to sugarcoat this at all. I have some that I can't get well, and it's heartbreaking and horrible. But I have many that I can, and it's really redeeming and wonderful, and give the opportunity to have a big impact on someone's life is just a gift. So
that's definitely life-saving.
Yeah.
Do that. All right. Well,
thank you.
Guys.
Thank you so much.
Thanks.
Bye.